Hi, I'm Dr. Emil Tompkins, and along with nausea, fatigue, and swollen feet, most women experience back pain at some point during their pregnancy. Pregnancy-related back pain affects all sorts of places. The most common is the lower back. One of the reasons why, and we can get into this, is during pregnancy, your body releases a certain normal number of hormones. These hormones are designed to allow your body to expand and grow so that you can hold baby and then also prepare for labor and delivery when it's time for that. It is an amazing thing that our body is created to do. However, in doing that, the ligaments and tendons and everything that's designed to hold everything into place, they're not doing that anymore. They are allowing you to spread and expand, and things very easily move out of position, especially when you have the pressure of moving baby inside. Lower back pain is the most common pain that we notice during pregnancy. Once baby's born and we're holding baby and breastfeeding and that sort of thing, then mid and upper back pain are the most common things that we notice. Let's talk about the ways that we can get on top of this. First, let's talk about some of the causes. So during the first trimester of pregnancy, hormonal changes and stress are the things that will do it. Now, I started to mention it. Levels of progesterone will increase in the body during that first trimester. They increase rapidly, so that relaxes muscles and ligaments through the pelvis, and so the pelvis isn't going to stay aligned. Now, another hormone that's called relaxin helps the egg to implant into the wall of the uterus. It also prevents contractions during the early stages of pregnancy. Again, really important stuff. It also, during delivery, it stimulates the cervix to open in preparation for delivery. Really important stuff. But in relaxing the ligaments and joints in the pelvic region, it keeps things from being stable in your spine. So, and that will then lead to postural problems, lower back pain, and instability. The next area is stress. Although we may consider pregnancy this really exciting life event full of changes, and it is, it also does introduce a new source of stress. Stress affects more than a person's mood or psychological state of being. It can cause physical symptoms like fatigue or headaches or stiffness or muscle pain. Now, during the second and third trimester, usually what's happening during this period of time, the uterus continues expanding as the baby grows rapidly. There are lots of postural changes, weight gain, muscle separation. All these things contribute to lower back pain during the later stages of pregnancy. Number one, a woman's center of gravity starts to shift to the front of the body as the baby gains weight. Some women may lean back then in order to regain balance, but then leaning back puts more pressure on the spine and on the back muscles that will then lead to back pain and muscle stiffness. Weight gain is next. The weight someone gains during pregnancy can contribute to that lower back and joint pain, because the amount of weight that you gain will then put more pressure on your spine and can impact your overall health. Now, the Centers of Disease Control and Prevention, they recommend that women carrying a single baby, according to their pre-pregnancy weight, we'll go over that, 28 to 40 pounds if they're overweight. That's a normal amount of weight gain. If you're a healthy weight, 25 to 35 pounds. If you're overweight, you only expect to gain 15 to 20 pounds. If you're way overweight, if you're considered obese, then 11 to 20 pounds is a normal amount of weight gain. If we go beyond that, well, even that normal amount of weight gain can cause some discomfort, but if you go beyond that, then you're really setting yourself up for more problem. Muscle separation. The abdomen, as the abdomen grows, you have two parallel bands of muscles, your abdominal muscles. They connect the middle of the abdomen, and that can spread during pregnancy. When that spreads or separates, it's called a diastasis recti, and what that does is then it doesn't provide the same level of stability and strength, and can lead to more common instances of lower back pain. So let's talk about how you can relieve that pain. There are times where it might seem that low back pain is inevitable during pregnancy, but I'll let you know there are ways that you can relieve that pain both during and after pregnancy. In our office, I see people all the time who are dealing with this kind of pain, and we help them in so many ways. But let's talk about some things that you can do right now. Number one, regularly stretch your lower back. Number 2, sleep on your side with a pillow between the legs and below the abdomen. Number 3, use a warm compress to relax tight muscles and reduce inflammation. Number 4, let's start making some postural changes. Making postural changes like standing or sitting upright so that the back is straight and the shoulders are square. Next, wear a maternity belt for extra abdominal and back support. Next, use a lumbar pillow or additional back support while sitting. Use prenatal massages to relax tight muscles, improve range of motion, and relieve stress. Next, let's think about alternative treatments like acupuncture and chiropractic services with a practitioner who specializes in pregnancy. Every day in our office, we see parents who are going through their pregnancy, whether they're feeling fantastic or not, and our goal is to make sure that the nervous system is functioning as well as possible. And as we do that, we help to balance out that lower part of the spine and pelvis. That starts to equalize the weight distribution in the body, so we're not putting too much pressure on one area compared to the other. And then as you do that, you will start to notice that you feel better. And if you feel better, then life is going to be more comfortable for you and baby. The nervous system is traveling, those nerves are feeding the baby as the baby is growing and developing. That's going to be incredibly important. So not only does it help you, but it will help your baby too. Now, let's talk about some other things that you can do to prevent or avoid pain. 1, strengthen the muscles of the back with pregnancy-friendly exercises. Number 2, maintain a healthy weight throughout your pregnancy. Number 3, do gentle exercise regularly with a doctor's approval. Number 4, wear flat or low heel shoes with arch supports. Next, avoid standing for long periods of time. Also, avoid lifting too much weight and practice proper lifting techniques by squatting down and using the legs instead of the back. For those that just bend over and grab things and then lift up, you're asking for trouble. Next, practice good posture. And then last, avoid sleeping on your abdomen, which is going to be a point that you're not going to be able to do that anyway. But let's start getting out of the habit now, because it doesn't support your spine well and will create problems over time. So guys, I think that's all for today. You learned a lot of things here as far as ways to prevent weight gain, some of the reasons why we have pain in the first place, and then some things that we can do to be able to help you. I'm Dr. Emil Tompkins. I hope you have a fantastic day, and we'll look forward to seeing you soon.